Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Today, our focus is on women's health, and our guest is Ginny Clementson. Ginny is a nurse practitioner with Mayo Clinic Health System who practices in obstetrics and gynecology. Ginny, thanks for joining us today.
Thanks for having me, Jason.
Well, when it comes to overall women's health, let's start out with some of the biggest threats to women's health.
Well, women's health encompasses lots, but I would say the big ones are obesity, heart disease, diabetes, lack of exercise, probably lack of time in a woman's life with the busy lifestyles they have, and getting in for their preventative exams.
So, Ginny, what about heart disease? I've heard that that's the #1 killer of women in this country. Well, talk a little bit more about heart disease.
It's an extremely important topic because it kills more women than breast cancer does. One woman every minute dies of heart disease. And the interesting difference between men and women is menopause. And estrogen has a protective effect on our hearts. And so most women that have heart disease or heart attacks or die from heart disease are menopausal. So their average age of menopause is 51. And so you're going to find death rates are over that. And it's because I talked about it briefly, obesity, diabetes, high cholesterol, smoking, inactivity, but the loss of our estrogen, which was protective for us.
You know, it's a great point, too, because I think the misconception out there is that, breast cancer, obviously, it is out there and it does affect many, many women. But when you think heart disease, normally you don't think that it would be the #1 killer of women. So it's a misconception. It's important to talk about.
Right.
That.
And I think women in particular, our symptoms of a heart attack are way different than a man's. And so we can say, oh, I have an upset stomach or I'm nauseous because I did, you can always make excuses and not get yourself into the emergency room when a man would say, has this crushing chest pain and that he knows he needs to go in. It's different for women.
So what are some common symptoms of possibly having a heart attack for women? For women, shortness of breath.
The pain that you might experience could just be some upper back pain. Nausea and vomiting can happen. But, those are things that, you think, well, I ate something wrong or I lifted something wrong, and you might not recognize it as I'm having a heart attack.
So what are some of the preventive ways that women can help reduce some of the risks that are associated with some of those chronic conditions?
Right. Well, we can't do anything about the families that we were born into because there's the genetic factor, but there's modifiable risks. You can try to maintain a BMI of 25 or less, which you can do by eating healthy, lots of fruits and vegetables, low-fat meats, whole grains, and getting at least 30 minutes of daily exercise that gets that heart rate up. So it's cardiovascularly important. Also bone-strengthening exercises. So anything that you're using, you're lifting things. You don't have to go to a gym to do it, but just overall good exercise, adequate sleep. I think that's a major factor for a lot of women is their sleep or lack of. 8 hours every night is really important of uninterrupted sleep. And just managing their stress. But by doing the things that I talked about above, the stress is managed pretty well.
Some other obvious things I would assume would also be if you're a smoker to stop smoking.
Yes.
And also alcohol as well.
Yep, thanks for mentioning that. Yes, stop smoking if you do smoke. Don't start smoking. I think the biggest culprit is the social smoker. She starts in college and she has 1 or 2 with friends when she goes out. Pretty soon life events happen, stress, and pretty soon she's smoking a pack a day.
Ginny, let's also talk about bone health. And osteoporosis affects so many women out there. What's your advice when it comes to bone health?
I start my bone health in talking to my young women because they're probably the ones that are drinking drinking a lot of soda. Soda's got a lot of phosphorus in it, and that's not good for our bones. So trying to drink less soda is good. Important to drink lots of milk. Now, I get a lot of patients that say, boy, I just can't drink any milk. I don't like it. Well, there's lots of calcium sources. Almond milk, soy milk, well, sardines, not a lot of people eat those, but it's very high in calcium. Yogurt is high in calcium.
Vitamin supplements too,
right? And it's important to, our bodies can only absorb 600 milligrams at a time. So when I tell women, you need 1,200 milligrams every day, but don't take it at the same time every day, both of them, because they come 600 milligrams, because you're just going to waste half of it. Look at the back of your cartons of the milk, yogurt, whatever you're using for calcium in your diet. See how many milligrams of calcium that contains, and then substitute or supplement with a calcium pill.
Well, you know, for many women, Ginny, breast health tops as the list of their health concerns. So talk a little bit about that, starting with what are the recommended screenings and also self-exams.
Yep. So screening, as far as that goes, mammograms start screening at 40. And do them yearly after that. But really important, at my GYN exams, I teach women how to do their own breast exams. It's important to do that. A lot of women say, well, no, I don't do my breast exam. I don't know what I wouldn't know a lump if it hit me in the face. And I always say, well, just knowing your body is what's important, and knowing if something's different. Doing a breast exam a week after the menstrual period is probably the best time to do it.
And so if a woman finds something that's a little out of the ordinary, wasn't there before, something feels different or looks different, should she see her healthcare provider right away, or should she wait and see, or what do you recommend?
I recommend getting in right away, because it may just be nothing, and many, many times it is nothing, but it's really scary, and you don't want to wait until, wait a month to see if it goes away. I would recommend coming in right away. If I feel anything that I think, well, I'm not sure, I'm going to send her for a mammogram regardless of her age.
Well, let's switch gears a little bit and talk about human papillomavirus, or HPV. I've heard a lot about that in the news recently. What is HPV?
Well, like you said, it's a virus, and it's very common. 85 to 90% of sexually active people have it, have had it, have been exposed, got rid of it. It's very common, and there's vaccines against it now. We can start giving those at age 12, and we can actually, you know, the studies were done to 26. I recommend it at any age, actually, because there's any time in your life you may be exposed to that virus. It's common. The virus or the vaccine goes against 4 of the most common. 2 cause cervical cancer, 2 are against genital warts. And
so, and HPV, it doesn't have to deal with just genital warts. It's warts in general, right?
Right. It's many people are surprised. A plantar wart on your foot is HPV. The warts that children can get on their fingers is HPV. But what's important to understand about those 2 particular kinds, or that particular subtype, it does not affect us genitally. So if you have it on your hands, it is not going to get transferred to our genital area.
The ones that we're most concerned about are you said there's 4 or so that possibly cause or do cause cancer, right?
There's 2 that are causes cancer that the vaccine takes care of, and 2 that are genital warts. So, but there are other ones out there, but the vaccines were, the companies looked at what are the most common viruses that cause, or the types of the HPV that cause cancer, and that's how they made their vaccine.
And I would assume that your yearly exams very important for helping prevent this, right?
Right, and we do pap smears. We used to start them way earlier than we do now. We start at age 21, and it seems to be really effective. Younger women's immune systems are really strong, so even if you are exposed to the virus, you're probably going to get rid of it within 12 months. And so we don't start till 21. If you have normal pap smears, we really spread it out between 2 and 3 years.
Let's talk about birth control now, and in particular the birth control pill. You know, there's plenty of information and a lot of misinformation that's out there in regards to the pill. But let's start with the basics first. What exactly is the birth control pill, and what does it do to women's bodies?
All right. The birth control pill was developed in sometime in the 1960s. It's developed, or it's much less hormone than it was then. And basically what it does, it stops ovulation. So if you don't ovulate, you don't get pregnant. And so that's basically how it works as a contraceptive. There's non-contraceptive benefits to the oral contraception as well. And many women, young women, come to me and say, my periods are terrible, they're heavy, they're crampy, and then I have all this acne. Well, the birth control can really help that as well. So there's all the non-contraceptive benefits, some of which decreases our risk of ovarian cancer, can decrease our risk of uterine cancer as well.
We talked about possible misinformation out there as well. So true or false, does the pill cause weight gain?
Basically false. It may cause a slight amount of water weight gain, but there's probably any of us women that will have that in our menstrual cycle. So the woman that comes to me and says, you know, I won't take the pill because I gained 20 pounds when I went to college and I was on the pill. Well, there's some lifestyle issues there, college, getting away from home, not exercising maybe as much as they did, maybe drinking a little too much beer, et cetera, et cetera. It probably wasn't the pill that caused the weight gain.
Well, other than the pill, what are some other birth control options out there that are for women?
For women especially, there is the IUD. It's an intrauterine device. Works a couple different ways. It basically does nothing to ovulation, so a lot of women like that because their bodies are still doing what they quote-unquote think the body should be doing. It prevents pregnancy in other ways by not allowing the sperm to get to the egg. That's how that one works. There is the vaginal ring, and it's placed in the vagina. It is estrogen and progesterone, just like the pill is. It's just put in the vagina for 3 weeks and taken out, and the week that you have it out, you have a period.
And the benefits of that versus the pill is you don't have to worry about making sure that you take the pill every day.
Daily, exactly. And I think that's where any of my patients or many women have said, well, I got pregnant when I was on the pill, but I didn't take it correctly. We have perfect use of any birth control method. And then there's usual use. So usual use is forgetting.
So what are some other birth control options?
Yeah, well, there's the shot, and that's given every 3 months. There is the patch, and that patch is put on a weekly basis. And then there's 1 week without a patch, and that's when you have a period. There's pills that are packaged 3 months at a time, or 3 months in a row, and then you only have 4 periods a year. I really can do that with just about any birth control pill on the market.
And obviously, none of those birth control options that you're talking about prevent sexually transmitted diseases, which is important, but there is one birth control device that does do that.
That is the condom.
Yes.
Yep, and that again is, of course, a birth control method in and of itself, but always having a condom on hand and not relying maybe on the man to have it. Just keep them with yourself in your purse or something. And before the act of intercourse, here, put this on. We're not doing this unless you put this on. Will protect you from many of this STDs.
So Ginny, what if a woman misses taking the pill a couple of days straight, has intercourse, and may be worried that she may be pregnant because of that?
Right.
What are options then?
Well, the option is over-the-counter Plan B, and it is all it is birth control pills that you take both at the same time, and in many cases it will prevent pregnancy, and all it's doing is stopping ovulation. And that, you could take that as well if you had a condom failure.
And that's taken over the counter?
Yep, and you can go in and purchase it. Actually, it just changed age-wise. It brought it down younger too, so you don't have to be 17 to buy it anymore.
Well, unfortunately, we are all out of time, but I'd like to thank you, Ginny Clementson, nurse practitioner with Mayo Clinic Health System, for joining us today on Speaking of Health. Thank you very much.
Thank you for having me, Jason.
Have a great day, everyone, and be healthy.